In clinical practice, the patient always comes with a simple version and simple statement, which are most common symptom, but it is very helpful to individualize the patient. Not every case comes with a peculiar qua rare PQRS symptom. Not every case comes with uncommon symptom. So we have to pick the exact rubric from common version of the patient. For example, today I have seen one simple case that takes 5 minutes to prescribe the remedy. A case of acute throat infection with a cough. The patient says that I never experienced this type of cough, this sort of throat pain and suffering, which is very severe. I have never experienced this type of cough. My throat is burning. My body is fully painful. Every joint is painful. My whole joint to joint pain is severe. I can't bear it. I cannot manage this cough. I have never faced this type of cough. I have tried so many traditional way of eating palm candy for cough, but nothing helped me. The case finished within 5 minutes. I prescribed a remedy, Platina 30. We cannot imagine the remedy Platina for cough. Very common version of the patient is sufficient to individualize the patient while we are converting the patient version to mind rubric. I have prescribed the remedy Platina. I took the rubric mind delusion help calling for. His body started asking for help. His body started asking for help. So he wanted to cure by himself. So he used self-medication. He used palm candy for cough. So I took the rubric delusion help calling for, intense burning delusion fire cease. So I have never experienced, I have never faced this type of cough. So he feels change. So delusion, imagination land up in strange land. Whole body is pain, intense pain. So injury, delusion, injury, injured being. The pain is intense, severe, as if injured. 4 delusion symptoms covered by Platina. I have prescribed a remedy Platina 30 single dose.